Welcome, welcome. Welcome to my guest, Dr. Hollis. And first, I'm going to introduce Dr. Hollis. Um, Dr. Hollis has a very long CV, but I'm going to focus on some of the highlights. She and I went to Meharry Medical College at the same time, and she received a Ph.D. in biomedical sciences from Meharry Medical College. And then she went on to do a postdoc at the School of Public Health at Harvard. And there she was looking at the adverse effects of inhalation exposures on health. And then she worked for a while at the CDC, and I know she was involved with toxicology there. And then she went to Rutgers University School of Law, where she got her JD. And she is now a senior climate justice and health scientist at the Union of Concerned Scientists. And tell me, Adrienne, are you still involved with academics in the DC area? Because I saw on some of your credentials online too that you were involved at American University.
Yes, first, thank you for having me. And what Dr. Satcher didn't say, or Serena didn't say, is that we were roommates in Massachusetts, in Boston, for I think a year and a half, 2 years.
Yeah, while you were doing your postdoc.
She was doing her residency, and I was doing my postdoc. So let's not forget that. So, and I got to know your brother, Bobby, the astronaut. But yeah, I also teach. I used to teach at American University, appellate advocacy, with my law degree, and I also taught and still teach. Although I'm sitting out this 10-week session, at George Washington University's School of Public Health, Milken School of Public Health. And so I'm one of the session leaders and an environmental health course there, where I interact with students from all over the country who are online students. So I love it. I will always hopefully keep my hand into the academic world. So.
Well, I love that. I mean, when I saw that, I was like, wow, this is awesome. And of course, you're an expert in what you do. So that's why I wanted to interview you, because I was very excited when I saw some of the blogs and some of the things that you were writing last week and this week. So the reason why I've been doing these interviews is because I started doing research, as I mentioned to you earlier, with a friend of mine, Dr. Sue Fairchild, in late December and January, looking for holistic solutions for infections with COVID-19. And I had a conversation with my parents in January saying that I believe that African Americans and people of color were going to be affected more than other groups by COVID-19, which has turned out, unfortunately, to be true. And so I started this series, started filming it in early February because I wanted to try to get the word out to people about what people of color and melanated people should be concerned about, and also talking about what people could do. So I've been interviewing physicians, but I've also been interviewing other clinicians and people that are involved with health and wellness. Can you talk a little bit about what your PhD was? I know you were in the field of nutritional biochemistry. Can you just speak briefly about what your thesis and PhD were involving?
Sure. My dissertation was on high pressure oxygen, and the kind that you use, that Air Force jet pilots and deep sea divers are exposed to, and whether protection is offered to those individuals, and also those who have wound healing issues, like from diabetes, you have a sore that doesn't heal, right? Whether they needed protection from that high pressure oxygen by using antioxidants like vitamin C and selenium and also vitamin E. And so I did that, and that was in that was inhalation, because I looked at the lungs, so inhalation toxicology. And then when I went to Harvard, that sort of changed, and we changed to ozone, which is, of course, a big prevalent pollutant for communities. So instead of looking at hyperbaric oxygen, we started looking at ozone, because that's an everyday contaminant that we're exposed to. And we still looked in rats, studies in rats, but I became interested in humans. And so from there, I remember when I was there, I went to a meeting in Atlanta, actually the first People of Color Summit. And, one of the issues was air pollutants and how people were developing all sorts of adverse health effects, cancers, respiratory illnesses, things of that nature. So my research has sort of matured, I guess, and become more person specific, as opposed to how is this affecting animals, because I was finding it hard to make that correlation, right, between animals and people.
Mm-hmm. Wow, I didn't even know all that, and that's very exciting to me, because I've been studying ozone as a therapy also for COVID-19.
Okay.
It's not widely available in the US, but in Italy and Spain, they've been giving it intravenously.
Oh, okay.
And there's a method that they use to get more ozone into the bloodstream. We are using ozone in the United States. In some places, there are people that are doing that therapy. Like there's a guy that's in New York, there's a guy that's in California. Ozone is being used to like inject in certain parts of the body, like for joints and different things like that. But specifically for COVID-19, the FDA won't approve it yet widespread, because they're saying they want to see more studies, but there are a lot of studies in Europe. And they've had a lot of success with just treating people like one day, and then literally like 1 or 2 days of treatment, and the COVID's completely reversed. Yeah.
Interesting.
Yeah. So, and you were talking about vitamin C as an antioxidant. That's another one of the therapies that's been used for COVID. It's being studied in New York right now, but it was studied in China. They had some good success with it. It's not clear.
I'm not surprised as as a protectant,
Mm-hmm.
but now I've been trying to order vitamin E supplements, and you can't get it anywhere.
Yeah, you can't. It's hard. I can hook you up with a place you can get it from. It's hard to get vitamin C right now, D, E, anything that helps the immune system, but especially the antioxidants and other immune modulants, which is what me and Dr. Sue talk about in some of the videos that we're going to publish along with this series.
Mm-hmm.
So,
I mean, luckily I've been taking vitamin D3, but that's,
that's important.
Yeah, and I've been taking also B12 and biotin long before, for the past few years, but I had stopped taking vitamin E, which we all should be taking, and vitamin C. So I was able to get the little powder that you put into water. And so I've been taking that. Yeah, so
that's actually better.
But that's interesting about ozone. I'm going to have to look into that. It's been a while since I've done bench research,
Yeah. So I can send you some information.
Please do.
But what did you do at the CDC, and what was your goal after you left CDC and went to law school? Like what was your goal, or what were you aiming for the career?
So I was working, actually, your uncle was the head of CDC when I was there. And I was actually at the sister agency to CDC, which is the Agency for Toxic Substances and Disease Registry. But he was over both agencies. And
Mm-hmm.
while I was there, I was a section chief, and we sort of examined contaminated sites to determine whether there was an immediate public health threat to communities in the surrounding areas. For example, we had a site in Puerto Rico, I mean, not Puerto Rico, in the Virgin Islands, where people, where I guess the Environmental Protection Agency had shut down the wells, and well water is, it's surrounded by salt water. So well water is something that people need, a necessity. But it was contaminated because there were a number of facilities in the area, gas stations and what have you, that had been contaminating the water underneath the soil, the groundwater. And every time it was locked up, the wells were closed, they would open them. The community would open them because they needed it. And they were like, well, we're not getting sick. Because most of this is with chronic exposure. So they weren't seeing any immediate effects, but it was pretty much, some of the contaminants that were present were pretty much associated with a variety of adverse health conditions. So we went out and sort of like met with the community to get their concerns and whatever. And the reason I left there to go to Florida A&M University was because I wanted to do more applied research, working directly with communities to address their issues, instead of making that a small component of this health assessment. I wanted to work with them directly to address what was the threat in their communities and how could we combat that. And one of the things we developed for ATSDR, which is the sister agency, was a toxicology curriculum for communities, sort of a train the trainer approach where they could teach each other about the toxins in their communities and they could make it specific. And I know that ATSDR still uses it, and it's actually been translated into Spanish, which is pretty cool. Wow. But it also, you have to make it community specific, right? Because everybody doesn't have the same type of exposure. So, but meaningful work that, it doesn't go to an agency, it goes to the people who are most at risk. That's what I wanted to do. And I wanted my students to be exposed to this. So I would always take them with me to the communities, to the point where if I came by myself, it was like, why are you here without your students? Like, and my students, I call little Erin Brockovich, right? Little Erin Brockovich students, and we would, because that's the only way you're really going to have meaningful impact, is to partner with people who are fighting against these, hazardous substances. So.
Yeah, I'm sorry I left out FAMU. Yeah, we want to give them a shout out. You did have, how many years were you there?
I was there for 6 years.
Wow, I
But
didn't
if
know.
we're going to give FAMU a shout out, then we have to give Jackson State a shout out, which is where I got my undergrad degree. And then we already gave Meharry a shout out. So these are 3 HBCUs that, because I believe in the power of the people. So
yeah. So, and thank you for that information. Yeah, I always kind of lump ATSDR together with CDC. Yeah.
Yeah, because it's,
they
same director.
Hand in hand. Yeah. And so next, I just wanted to bring up the new book by Harriet Washington, introducing many people who had not known to environmental racism, which you've been, working on for years. And I just wanted you, because a lot of people don't even realize like what it is or that it exists. And I have family members, or my whole family is affected. I mean, I was there too, not as long as my parents, but Anniston, Alabama is one of the sites that Monsanto polluted the groundwater. And now everybody that lived there is getting cancer. Even I have friends that are younger than I am that grew up there that now have cancer as a result of being exposed to the PCBs in the groundwater there. And I saw your tweet last week talking about how environmental racism could be contributing to the COVID crisis in communities of color or within melanated people.
Right.
Can you speak to that?
Yes, and I would say it's not a could be, it's a is,
Mhm.
because I'm from Alabama too, as you know, from Mobile, and if I can take a step back, you know, environmental racism, which is really what it is, was a term that I think some people felt uncomfortable with, and this was before I became involved in it, and it became environmental justice, right?
Mhm.
And it's really it became prominent when facilities that release pollutants into the environment really moved to the south because there was more
Looser laws.
yeah, freedom when it comes to polluting. There are more of us. We needed jobs, and a lot of people had to make a choice between working and I might get sick to being able to feed my family or give them the medicine they need or whatever it is. So I think a lot of facilities took advantage of that, right? You know, we have the old Cancer Alley, and we can talk about Anniston, Alabama, and Tallahassee, Alabama, and just on and on. So the South is, you know, even Mobile, we had the International Paper Company and other companies right around that surrounded us. And we were told that that was the way money smelled when it was that sulfur that was being released. So
Mhm.
that's kind of the work that I do. Now, the reason that, and it's not just me who says it, you know, the last blog I just released was with Professor Shakobi Wilson from University of Maryland. And others have said this, but I wanted to talk to an African American and get his perspective, and that's particularly why I reached out to him, as well as the fact that I know the work that he does with communities, you know, his environmental justice work. So when you are exposed to, when you live near polluting facilities, and everybody knows, well, and it's known that African Americans are more at risk. The chances of African Americans living near, within, I think it's 3 miles of a facility, is like 70% or more, right? I mean, if you just think about it, most African Americans who are, and we're lower, you know, middle income, lower middle income, live in these areas, and that's from redlining and activities that have historically happened where we've been victimized because of our race. And so in these areas, these are the same areas that polluting facilities have set up shop. Right. So when we're inhaling and ingesting these contaminants, like you said, PCBs and other contaminants, and being exposed to greenhouse gases, and we have people of color communities, because now it's not just African Americans, people of color communities and low income communities, right? Say
And
one of the big,
there's some that's hidden too, right?
yeah,
I just want to interject that because I heard that like when with these nuclear waste, often you see them transporting that on the highway, and you're wondering where is that going? They're always going south.
that's right. They
Hmm.
put a lot of matter of fact, I was just in, not just last year, I was in Pensacola, and I spoke with a wonderful woman there. I was part of this Freedom to Breathe tour that I was a part of with Climate Nexus, and she said that the landfills there, they were surrounded by landfills, the community, and most people had died or moved out, but most people can't afford to move out, right?
Hmm.
The landfills were accepting hazardous waste because you get paid more, right? But and they used to have spontaneous fires. And it could
Ooh,
be methane, could be anything else. But the one
yeah.
particular incident, the gates were locked, and the firemen couldn't get in because the gates were locked. Plus, they didn't know what was burning. And if you don't know what is burning, you don't know what to wear, right? Because you could be
Hazmat.
inhaling, yeah, you could be
Yeah.
inhaling something but so you don't want to breathe anything that's has cyanide in it or whatever. But imagine the communities that have to live in this plume, and when they try to escape or to leave the area, they have to drive through it. You know what
Hmm.
I mean? So, and it's not something that disperses, and when it disperses, it's only going to disperse within a certain area, right? So
Hmm.
all of these things, and you know, we there's evidence of increased asthma in children and adults who are inhaling some of these contaminants or just living in environments with poor air quality, chronic obstructive pulmonary disease, increased cardiac arrest, right? All of these things. And people don't, a lot of times, people can't go out and exercise and go for a walk with their dog and whatever. So, yeah, they do spend a lot of time sitting around. So that may be another reason for obesity, right? People are obese. So then the point is, if you look at CDC's website to see what the guidelines are for what makes you more at risk from COVID infection, then African Americans fit that category, fit so many different, so many different factors in that list. It's crazy.
Mm-hmm.
And so, just like you in January, it was something that was my first thought. Oh, if this is a respiratory illness, then we're already at risk because we already have compromised systems. And so that was the initial message, and that's still the message that I'm getting out, which is why, as I said to you earlier, I'm very disappointed in the Centers for Disease Control latest update to this guideline, where I don't see what they've changed much, but what I don't understand is why they didn't add in African Americans are particularly at risk if you live near, if you've been exposed to, because there's data from different states, different cities. I don't remember one report that said we have a high number of African Americans living here, or we have a number of African Americans living here, but we don't have the cases that we see are not mostly African American. I haven't seen that kind of report. All the reports I've seen say the majority of our cases are African American.
Yeah.
The majority of our deaths are African American.
Yeah.
And I'm not saying that environmental exposures are the only reason, but I think it's a big contributing factor. So
yeah, and I'm wondering about like, for instance, Louisiana. When you go down there, I don't know what the industries are, but the air doesn't smell clean, the water doesn't.
Oh yeah, Cancer Alley, everything down there, petrochemical plants. I don't know if you know that a number of, now under this administration, facilities are stockpiling oil, right? Because the price of oil has dropped to zero or is below zero. Yeah. So they're stockpiling it right off the coast, not just on the Gulf Coast, but other places. And it makes me think of, this is the 10-year anniversary of the Deepwater Horizon oil spill and fire, explosion, whatever. And so you're stockpiling this stuff. People have been breathing this stuff. Cancer Alley is only getting bigger, right? And people always say, well, you knew this was here and you shouldn't have moved there. But in most instances, that is not the case. They did not move there. They were already there. And then in other instances, you have places where
it's also jobs, like you mentioned before, because I have relatives that live in Houston and off the coast of Texas, Galveston. That's where a lot of the jobs, just like Louisiana and the
petrochemical plants, all of that. And also, this was in Houston. I forgot where it was. I'm glad I'm not going to say it, but the facilities had reached an agreement, I think, with EPA to clean up. They cleaned up the property to a certain level, whatever that level is, but it's acceptable level. To me, the acceptable level is zero.
Right.
That's not necessarily.
To me, too, coming from holistic medicine. Yeah.
But that's not necessarily the guidelines. And what they did was, once they cleaned it up, they installed air monitors, and air monitors are usually installed on the fence line, not in the community, right? So, in this particular instance, they had people who bought home, they sold homes to these, they moved everybody out and bought their homes, right? And that was mostly upper middle class white people, whatever. And then they resold them to people who normally would have no opportunity to buy their dream home, right? These huge homes at such a low price, but they're so low because you're living near this contamination, and you have to sign a disclaimer saying that you will not sue.
Wow.
Because you have the knowledge that this was a Superfund site, Superfund being a hazardous waste site. But your dream is to have your own home, because home ownership is one of the things that has been denied to most African Americans, right? We don't make enough money, and we don't have the jobs. And don't forget, in the past, historically, we were denied loans through the banking system and whatever. So,
and I mean, as you speak, I'm thinking of Chicago, where I used to live too, and all the smokestacks, the steel mills, and the oil refinery just right off the Lake Michigan there.
So New Jersey, where you live now, if you go over to Ironbound, that's there's a great organization there, and they have a huge problem because I mean, it's called ironbound because that's where the steel mills were, and iron ore and stuff was made and all that. I mean, was used and all that sorts of things. So the people are contaminated, are breathing in contaminated air. The water, the river down there, you know, because of course, you know, Newark is right on the water, is not a good place to be, you know.
Yeah.
And so yeah. So
yeah, they're actually in the process of building more housing right along the water. But I keep looking at the water and how it smells there and the appearance of the water, thinking it's probably not a good idea to be right there.
yeah, and then the second question is who's going to buy those? Who's going to live there? Because a lot of it was rental property. Because there's this whole thing called, you know, how we talk about gentrification, right? Just moving us out, like DC, even where I live, is being gentrified. And there's this thing called climate gentrification, where you know, at one point we as a people don't normally have the beachfront homes, the waterfront homes. We're higher up, right? But now with climate change, where we are now is desirable because it's away from sea level rise and chronic flooding and things of that nature. So you see this climate gentrification where the African Americans and the other communities of colors are being pushed out of that location now. And they're being, yeah, so then
I didn't know that's what that was. That's interesting
so,
because like a lot of people, like when I go to these business conferences, a lot of the .com people are moving to like Phoenix, Arizona, like Colorado, because those are inland, but they have like nice, you know, like outdoor climates, I guess.
I didn't make up. Actually, community member, not one of the community members for Union of Concerned Scientists, where I work, coined that phrase because that's what she felt it was. Is that not only did you move people out of the urban areas because you wanted to live in the suburbs, and then just like in DC, you wanted to live in the suburbs outside of DC, hence the metro system. Let's talk about transportation justice. And then now you want to live in DC. I don't know if it's because of this administration or what, but I want to live in DC proper. So it's no longer Chocolate City, right? Which is what it used to be known as.
Right.
And that was the media thing. But now with this whole issue around climate change and severe weather and things that living on the water, you want to live further up away from the water, right? But still have a nice view or still have nice property. So that's the whole issue, the whole thought process behind climate gentrification. Yeah.
Wow.
So, yeah.
That's a lot.
Yeah.
So what recommendations or suggestions do you have for melanated people regarding decreasing their risk of exposures that predispose them to the virus? And basically, I mean, this should be a question of not just the virus, because we're going to have there's going to be future pandemics. I mean, it's a harsh reality. So we need to improve our health like immediately. And I feel like this is a big part of it.
Yeah, it is. We do need to improve our health immediately. And we have to prioritize that action, like prioritize our most vulnerable. And it's not just, it's melanated people. It's people who happen to be, and this is for anything. I mean, as in my last blog, Dr. Wilson said, we should have learned from the hurricanes that have passed. We should have learned about people not being able to evacuate. We should have learned about forced migration when people had no choice but to leave, and the stress, the mental health issues surrounding that, as well as the physical issues. But we didn't think about that because it didn't affect individual people. We should have learned, we should be working, and we need to realize as a people, and this is all people of color, our indigenous brothers and sisters, people who have been traditionally marginalized, we have a voice. We need to use it. When you go vote, don't vote for people who don't support you, who aren't looking for you. That means you have to be involved. You have to hear what people have to say. And it can't be a popularity vote. It has to be a vote on the issues, right? Because we've seen so many, almost 100 environmental regulations that have been rolled back, modified, dismissed, or in the activity that I think the activity that EPA just engaged in 2 weeks ago, where they just totally got rid of or oversight for certain facilities. I mean, if you tell me if I pollute and I say it was caused by COVID, which I don't even get that, and that you won't find me, then yeah, I'm going to use that because that's money I don't have to pay. And in the South, they weren't being fined that much anyway. But now they've been giving the license to pollute, license to poison the people. And we need to make sure that we are very active when it comes to policy issues. And you don't have to be a lawyer or a legislator or a city council member to have a voice, right? These people work for you because we elect them. And so if they don't hold up, if they aren't doing what we think needs to be done to protect us, then we need to say something to make sure that doesn't happen. Now, another important thing we need to do is, first of all, stop listening to this misinformation. And I think you agree with me on that, because we have a lot of sources of misinformation, figure out who your trusted source is. For example, for a lot of people, it's the church, because our church is our cornerstone, right? So talk to your minister or your priest or your pastor about the issues, and hopefully, the faith community is playing a really big role, not only in climate change issues, but around COVID-19, because they're such a trusted source, and otherwise ask questions. There's so many webinars every day. There's so many great webinars that are free. Get on there and ask the questions. Listen, don't just trust what you hear. Ask questions. If you have, and don't ask people you don't, ask people that you trust, that to be credible,
Right. I mean, that's why I talk about people's credentials in the beginning of the video, because everybody I'm having on here, everybody so far has an advanced degree. So, and is an expert in something.
And that doesn't guarantee that they're, if I can, I'm going to mention it. There are people who are, I'm going to talk about the Surgeon General right now. Everybody isn't for us, and I don't know his name, so I won't say it, but we have to think about what the message is, right? Because the message has to be something that is accepted by the people. You can't insult the people, because I'm not going to want to listen to you. In that, embedded in whatever you're saying is probably some valuable information. So it's all about how you deliver that, how you interact with me as a listener, right? So we have to worry about that, and we really have to be active about there. In all these, most communities, there is an organization or two or three that address environmental justice issues. If you don't have the money, you've got to have at least an hour to be a part of a meeting or whatever, or even to make a call to your congressman or go by his office. If you're in DC, stop by. They'd love to see you and come with a list. Yeah, I voted for you and these are my issues, because they realize the importance of their constituents, right? And if they don't, you need to hold them accountable, and that should be their last year in office. If they're not doing, right by the people, like we were saying earlier about the person in Las Vegas who was saying that they were opening up all these salons and whatever, but that she wouldn't be going out because she had a family. Hey, a good manager, and I always say this, a good manager, a good leader will not ask you to do something that they are not willing to do.
And when I was saying melanated people, but I probably should say also poor people too, because poor people live in these areas. When the authorities are getting on TV and on the radio and directing people to open things back up, I think a lot of people have common sense, but a lot of us and a lot of people are tired of being cooped up, and they, so it's kind of like justifying them like going back to work or going back to life as usual. And you probably agree with me on this, like people they don't even have to read. If they would just get on like some of the social media and listen to people that they trust, right? And listen to their churches, like.
Yeah, I totally agree with you. I do, and this is to clarify what I think what you're saying. people who have, first of all, everybody, as you just said, poor people, everybody doesn't have access to broadband, right? And we know that. And that's when they do what you suggest, talk to your church member, church leader, or talk to someone. If you know somebody in the medical profession or in public service, public health service, talk to somebody, ask a question, make a phone call. You know,
most communities have a nurse or an EMT living next door or somewhere.
Right.
So.
But, you know, always assume the worst. I mean, to me, if you assume the worst, and I understand about people need to go to work. I do. I understand that. And I was talking to a minister a little while ago. That's the catch-22. I need to work to pay my bills. Well, when it comes to, this is going back, if I can, back to policy. The stimulus packages that have been released or whatever, they need to be better. I know we've never been in this situation before, but you can't take $100 off my rent, like my brother's landlord, or and he's not working, or you know, or defer my rent, because if I don't have it now, I'm not going to have it later.
And I'm living paycheck to paycheck.
Yeah, and taking $100 off of zero income is ridiculous to me. So we need to be, everything comes back to, we need to be vocal. We need to hold people accountable, because the people who are supposed to protect us aren't doing it. And so there's no cavalry. No cavalry is coming. We're the cavalry. So we have to take care of ourselves and each other. And we have to just, we have to be more vocal, even if it's not in your nature. I mean, I'm an introvert, as you know, but you can't sit around and watch this form of genocide happen. And we know that there are places, rural areas, that don't have access to healthy food, don't have access to medical care. You don't even have to be in a rural area to not have access to healthy food or Medicare. You know, we used to call it food desert.
You could be living in Newark.
Yeah, and then we used to call it food desert, but what it is, and Dr. Wilson named it, food apartheid. That's really what happens, because it's personal. But we need to make sure that we have resources to help these people. Just like you've seen those big lines of cars line up at the food banks and whatever. First of all, that's ridiculous. Secondly, what about people who don't have cars, who don't have transportation?
Well, in China, they put trucks out into the neighborhoods with the food.
That's better than, Meals on Wheels. They need to put more money into that. But even that, it's dangerous for people who are delivering, but more community gardens. I don't know what the answer is, but I know you need to put more money in there, or have grocery stores or availability, just like they were doing at first. At certain times, the elderly would come in and whatever, that's fine. But I think that if we haven't learned from anything else before, and we haven't for the most part, and not everybody, because we did have a pandemic group, right, that was disbanded by this administration. So there are people who are thinking about this, who realize, just like you said, this is not the last one, right? People should have learned from SARS or H1N1, just like Dr. Wilson said, but they didn't, because it didn't touch them over here. But
there's also a movie called Pandemic that it's not a movie, it's a series. It's on Netflix. It's on Netflix, and it was made, I want to say 2015. And I've been watching the episodes. So they forecast all this.
Yeah, so we have to learn. If we don't, but I'll tell you what, this moment that we're in now is a lesson we need to learn. We need to pay attention. We should never be in this position again. Never. We should never have hungry, unemployed people again. We need to make it so.
So as far as environments, like, should we be looking to live in different parts of the country? I mean, I just thought about what you were saying, and like I lived in Chicago, Newark, Indianapolis. Like, these are all cities where it's kind of like the inner part of it is overpopulated. There's food deserts. I don't know what the answer is.
I don't either, because I feel like COVID-19 is doesn't discriminate. doesn't discriminate based on location or race. And
Mm-hmm.
I don't, when it comes to, first of all, everybody can't afford to move. And I think instead of thinking about, my thought, instead of thinking about moving to a different location, which I wish we could do, we need to think about shutting down these facilities that are polluting us, holding them to a very, very high standard so that the area that we do live in is safer. I mean, even though it's short term, we've seen pollution levels go down all over the world. And I know that people have been exposed to chronically. So this short term pandemic isn't enough, but it gives you an idea of what can be.
Right.
So we need to, work on that. So because everybody can afford to move, so let's talk about cleaning up what
Yeah.
we have.
Okay.
And making it better.
Okay.
And move if you can. But where are you going to move to? Because COVID is.
I wasn't talking about necessarily getting away from COVID,
Okay.
but the air
Pollution in general.
water pollution, soil pollution. It just seems in some areas, it seems like it's a really high hurdle. But I know in Chicago that they have done things like put green on the roof.
Yeah.
Yeah, and that does help. And I know in New York, they're trying to do that too.
Yeah. I agree with you. I think if you can move, yeah, because the pollution, the facilities you'll see, if you go to any community, any community of color, I bet you within a 1 to 3 mile radius, you'll find a landfill or a facility, something like that. But when you talk about moving, let's remember that I mentioned this just a minute ago, transportation justice. People don't have transportation to get back into the city to work in most instances, And like for me right now, I'm afraid I live in Prince George's County, which has the highest number of cases and deaths right now in Maryland, which is really freaking me out. But and I'm afraid to get back on the metro to get to work in DC. I am. And I don't, and I think that that's going to go on for a long time. I think you'll see a lot of people with PTSD and all the medical terms. I'm not a medical doctor, so I don't know them. But so we have to think about if people are trying to move out, they'd have to have transportation to get back.
And jobs.
Yeah.
Yeah.
And then being out, sometimes I have a friend who lives on a farm. She's not a person of color, but she's lives on a farm, but they don't have access to
public transportation.
Ready access to grocery stores and all of that thing either. So sometimes you have to think about what you're losing when you're gaining. So yeah.
Yeah, and I have to say, like all those things that you just talked about, like when I've moved, into different areas, I'm always looking at pollution, the air, the soil, the water quality, public transportation.
Yeah.
And the problem in a lot of parts of the U.S. is lack of access to public transportation.
That's right.
Mm-hmm.
I mean, even in the DC, the DC, Virginia, Maryland area, it only extends so far.
Yeah.
And because of gentrification, we as a people are being pushed further out.
Right.
Well, then that's an issue, right? Because then we can't get back in. So
and
this
it
is a
kind of
perfect
defeats the purpose of public transportation, trying to cut down on the air pollution and the other types of pollution. Yeah.
Because it's designed to move people from the suburbs into the city, not for those of us who have no choice but to be moved out of the city, because I would love to live in DC. I can't afford it,
But two, then it's defeating the purpose. I mean, like in Northern Virginia, if you have to drive your car to get to Fairfax County to the metro, yeah, it doesn't really make that much sense.
Yeah, and then when you drive, and I don't know about Fairfax, but in some communities, all that diesel and vehicle emissions, that's usually through a community. Even the highways are set up through communities. I don't know why. But so you have that exposure coming down on you, and you can't open your windows, and you're breathing this every day, so I don't know. We have a lot of work to do, but we all need to be clear on what we want, first of all,
So the last part, or the last question, because I think we've covered just about everything else, was related to what we were just talking about, like how people can survive and thrive after this pandemic, after this particular one.
Right. I'll tell you what, how people always say, I can't wait for things to get back to normal or whatever. Well, normal wasn't good. Normal wasn't good for us.
Right.
And plus, we, as a country, as a world, we will never get back to normal. So it's all about creating a new normal that's better. And to do that, we've got to, if we want to survive and thrive, we've got to be a part of the planning process, because as the EJ community likes to say, if we're not at the table, we're on the menu, right? So you need to be a part of conversations. We need to make sure that we think about what this should look like, and don't feel like because for whatever reason that you're not qualified to provide input. If you're alive, you're qualified to provide input, okay? And so we need to think about, in this new normal that we're creating, we need to think about what makes sense for everybody. Like I said, cleaning up areas, or making sure that everybody people have access to protective equipment, so that we won't have a situation where our health professionals, frontline people, are running out. That's ridiculous too. And we need to make sure that there are plans in place in each city and state. We need to hold people responsible at the state, local, and federal level when it comes to protecting its citizens, because that is indeed their job. And it's time for us not to just let them collect a paycheck. It's not everybody, but we need to make sure that people are being held responsible, so that if they run for office, they're running because they believe in helping to shape this into a place that we can survive. And when it comes to running for office, we also need to think about that. We need to think about having people who normally have never thought about running for office. Think about it. If you believe in something and you're passionate about it, run for office so that you can make sure that it happens. Or doesn't happen in the case of, in some instances. And let's have some stricter regulations and rules, have some input on that. There are so many opportunities for public comment where you can call in, now you can't come, but call in and or write in and and your comments, like, this is ridiculous, this is killing people, whatever it is, but people don't do it. You don't see many people commenting, and part of that I know is because people feel like they're not qualified. But you don't have to be a scientist or an engineer to comment. People know this term, community science. People know better than anybody what affects them, because they have that knowledge that we don't have. Right? I don't live in Gaston, Florida, so I don't know what they went through, what the historical issues are that affected them. So we just need to start listening more, and we need to start talking more, and we need to be more involved. And I know we don't have time for that, just trying to survive, but that's part of what we need to design, a situation so that we do have time, so that we're not just going hand to mouth, living check to check. Because believe you me, I've been there. And we're always one step away from there.
We've all been there. Yeah. But the other thing I just thought about something is because I have some patients that are wealthy that live like in areas, they live further out from the urban areas, right? And they may have well water. And I just thought about this when you were talking, and that it really applies to everybody, because the people that have well water and live in these different areas, they have problems with their water too, that they don't even realize. I've had people in Northern Virginia test their well water, came back for things like manganese or heavy metals, or the soil is polluted and they didn't realize it because it was like dumped, years and years ago. So, because what I just thought about too was that a lot of times people, when it comes to people that are wealthier, a lot of times they're thinking about who they elect is going to benefit their taxes.
Right.
Or where the loopholes are going to be.
That's the one percenters.
Yeah, but they're not conscious about their environment.
Yeah.
Right?
That's the sad part. Yeah.
Because they're voting for someone who, like in the case of what we have right now, who has wiped the administration clean of most of the qualified scientists in all
Yeah.
the different areas.
Yeah.
So, you know, yeah, it creates loopholes for some of these businesses that are dumping. And yeah, maybe they can make more profits, but then it ends up hurting everyone.
It does. It does.
Including the person that thought they were getting something beneficial.
That's right. In the long run, it's going to, in the long run, we're going to find out. You know, you're going to find out.
We're already finding out.
Yeah.
Yeah.
So, you know, people think that they think that they're getting the best end of the deal, and then you don't. You know, farmers, you know, have you seen farmers pouring out milk and stuff on the ground and throwing away food? Yeah, they've been doing that because once it leaves the property, it's considered income, and they have to report it. Whereas if they dump it on their property, and this isn't all farmers, God, I don't want to say that, but if they get rid of it on their property, then they can write it off.
Wow.
But how many hungry people are out there that could benefit from that, right? And there's supposed to be, I can't remember what it is, there's a law that says that if you have excess food, it's supposed to be given to food banks and things of that nature. But I'm thinking that that's when it's been harvested and goes out.
Right.
But those are things ways that we can address this issue too, so that we can, in times of trouble, survive and thrive. Not just survive, but thrive.
Yeah. That's crazy. I didn't even know that.
Mm-hmm.
Thank you so much for all your time today.
Thank you for having me.
And I didn't mean for it to go this long, but
we had to catch up. It's been a while since I've seen you.
Yeah, and on this Earth Day week, I feel especially privileged to have you here. And thank you so much. And thank you for all that you do.
Thank you for all you do. And it's important to get this information out to people, you know, so I appreciate that you're doing this.
Thank you.
Thank you.
So I'm cutting.